The latest COVID-19 surge collides with cold and flu season, which creates a lot of confusion for people feeling under the weather. Touro family medicine physician Dr. Meredith Maxwell joins us with some ways that you can kind of tell the difference. Dr. Maxwell, good morning. So, I mean, how do you, coronavirus and the common cold, the cold is a coronavirus, so how do you tell the difference?
So the cold typically presents without fever, without chills. It's usually just like a stuffy nose, itchy, watery eyes, that kind of thing. But the thing where it gets really dicey is when you're talking about the flu and the coronavirus.
Okay, how about that? How do you know the difference?
They are extremely similar. Their symptoms are very much the same. Fevers, chills, cough, you can have even a sore throat, shortness of breath, those kind of things. But their presentation of after exposure is a little bit different. It's very subtle. So you could have symptoms from the flu anywhere from 1 to 4 days after exposure. And with COVID-19, it's like 2 to 14 days, but on average about 5 days after you have exposure. So that can kind of help you. But unfortunately, it's usually testing that we rely on to tell the difference between them, since their presentation is so similar.
So how long before you are no longer infectious if you have the flu or if you have COVID?
So flu, it's typically about 7 days. With COVID-19, it's about 10 days. But in very, very sick people and immunocompromised people, it can be as much as 20 days. So it's a lot easier to catch COVID-19, and it's a lot longer. The contagious timing of it. So I think that's why it's just so virulent. It's so easily spread. And a lot of times people don't know that they have it, and they're walking around, and then they have their symptoms later, and they've exposed all of these other people. So it can be difficult.
And I guess one of the mysteries of this whole thing is why one person, sometimes even a young person, can get very ill or even unfortunately die, and somebody else, I happen to know a doctor who had antibodies before the vaccine and didn't, or about the time they were rolling out, and never knew he had COVID.
Right. Well, I think it's dependent a lot on what your comorbidities are, what medical problems you have. So it's not just cookie cutter. Every person is unique. And then whether you have the vaccines on board plus the booster, that will minimize the symptoms if you do contract it and make it less likely for you to wind up seriously ill, hospitalized, those types of things. So it's still important to go ahead and get that vaccine if you haven't already, and the booster, because this could give you some defense against this thing.
So finally, if you are experiencing symptoms, just to emphasize that, what should you do?
I would probably call your primary care physician. At Touro, we have a COVID hotline where nurses are on there for, all day long answering questions about COVID. We can direct you on where to get testing, if you should test, if you should just quarantine. It can be very confusing about kind of where to go. So we'd be happy to answer those questions for us. And when in doubt, isolate first.
All right. Always good advice from Dr. Meredith Maxwell. Meredith, thank you.
You're welcome.
Appreciate your time as always.